everyone, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacement. I recently was asked in my Facebook support group to make a video for caregivers to watch so they can understand the magnitude of a knee replacement surgery. So this is what this video will be about today. But before we begin, if you aren't in my knee replacement Facebook group, please join. I will link it down below this video, or you can just search Succeed with Your New Knee on Facebook. And then also, if you're needing more information about knee replacement recovery and planning, my courses will cover everything in detail. So if you're watching this video, I will give you 10% off with the code YouTube10. I'll put it right here. So please visit succeedcourses.com to sign up. So as a physical therapist, I see many people go through this surgery. I've seen people have more pain than others. People are able to get up and do things around the house sooner than others. But in my experience, it is so random for who those people are. So first, I want to go over what happens during the surgery. And to preface, I don't want to scare the person who is actually having this surgery. I just want to give you the details on exactly why you're having pain and why you have that discomfort that's going to last you for many months. So the first trauma that happens during surgery is that incision right on the skin, right? We all know about that big, long incision, but interestingly, that incision rarely bothers people. But once they get under the skin, the surgeon has to cut into the muscle and into the joint capsule, all of which have tons of nerves in there. So this incision is the source of a lot of pain for about 2 to 6 weeks post-surgery. So as you can see in this picture, they do make a small cut in the bottom of the quad muscle, but there are different cutting options, but in general, this is the most common technique. This cut into the quad muscle is going to bring you a lot of weakness, especially with lifting the leg in and out of bed, sitting up and down from your chairs, toilets, etc. Using the quad muscle for the first few weeks is going to be painful because of this incision. And then on top of that, 90% of surgeons are going to use a tourniquet on the upper thigh to control bleeding during surgery. And that thing is on so tightly, it causes damage and oxygen loss to the muscle underneath it. This is going to be another source of pain and weakness. It will also give you some fun bruises. So now back to the internal incision. Once that incision is made, the surgeon then has to twist the muscle over and flip it over to get to your knee joint. So as you can imagine, the muscle twisted and flipped over like that for several minutes is not going to leave you feeling very great. Another source of pain is the kneecap. The kneecap specifically has a lot of nerve fibers associated. The surgeon is going to replace the underside of the kneecap along, with the femur and the tibia. So you will have 3 bones cut and replaced. Interestingly, most people don't have that deep bone pain in the femur and the tibia. Most of the pain is from the exposed nerve fibers from all the trauma during the surgery, which are irritated by inflammatory cells. So let's talk about that inflammation. This is going to be the majority of your pain and discomfort and frustration. With, let's say, a common injury like an ankle sprain, you're going to have inflammation for 8 to 12 weeks. Even like a bug bite, it's going to be red and inflamed for 2 weeks. An example, I hurt my back from lifting incorrectly. I had pain and stiffness in my back for 10 weeks. All I did was injure in something internally. I didn't have my skin cut, my muscles cut, sewn back up, my bones weren't cut. Metal was not implanted into my bones. So just from a common injury, you can expect almost 2 months of discomfort. So this gives you an idea of what to expect after a knee replacement. You will have discomfort up to 6 to 9 months, and some will notice swelling for up to a full year. So I don't say that to scare you. The discomfort will slowly decrease. You won't have the same level of discomfort for a whole year. It will get less and less over time. But I say this to teach you and your caregivers the extent of this surgery. Your body is receiving a new joint made of metal. It first has to heal from the trauma from the actual surgery, and then your body has to accept that you have a new foreign object in there. And then on top of that, you're supposed to exercise, you're supposed to stretch, and continually irritate the knee so it doesn't get stiff. Your new knee will be also very different from your old knee. In fact, it's not the same size. It'll be a little bit larger. So as you can see in this picture, your old knee has shrunk down. You've lost all that cartilage, the joint fluid, and you reach that kind of like bone on bone. And now you'll get a new knee and that space will open back up. So now you'll want to imagine all the tissues in the knee have to accommodate to this bigger knee. Even just the slightest tension on our ligaments, tendons, and muscles is going to cause discomfort. So you just went from this compressed arthritic knee that you've had for many, many years to now you have this bigger, taller knee within an hour after surgery. So ouch, right? So as you can see, there's a ton of reasons why you have pain. This surgery is unlike any other surgery. Essentially, you get your knee cut off and you get it replaced with metal. And then we say, yep, get up and exercise. So I hope this video helps you and your caregiver kind of understand the magnitude and seriousness of this surgery. This isn't just your basic day surgery where you heal in 6 weeks and you're good to go. This is a year-long recovery process. You're going to have discomfort for up to 1 year post-surgery. Again, like I said previously, the discomfort does lessen over time. And also, like I mentioned at the beginning of this video, if you are lost in your recovery process or you don't have access to physical therapy, or you just want to be very prepared for your surgery, please look at my website, succeedcourses.com, and register for the appropriate course. So as always, thank you guys for watching my videos and liking and subscribing. I'll see you again next time.